What if I told you there's a depression treatment that works faster than any medication, helps when nothing else does, and has been proven to be one of the most effective interventions in psychiatric history? You might think I'm exaggerating, but I'm not. Electroconvulsive therapy, or ECT, is one of the most powerful and successful treatments for severe depression, suicidal thoughts, and treatment-resistant mental illness. It has saved millions of lives and continues to do so today. Yet it remains shrouded in fear, stigma, and misunderstanding. When people hear shock therapy, they imagine painful, outdated procedures from the past. But the truth is, modern ECT is nothing like what you've seen in movies. I've seen the effects of ECT firsthand. I have worked with patients who were trapped in relentless, life-threatening depression, unable to function, speak, or even get out of bed. After a few sessions of ECT, they started to recover, regain their emotions, and feel alive again. This treatment is so effective that I consider it one of the most relevant tools in psychiatry today. Unfortunately, due to organizational constraints, I cannot offer it in my own department. Instead, we provide esketamine therapy, which also has groundbreaking potential, but I'll discuss that in another video. So why does ECT still have such a bad reputation? What actually happens during treatment? How does it change the brain? And most importantly, is it safe? Let's dive deep into the most misunderstood psychiatric treatment of all time and uncover the truth. To understand why people fear ECT, we have to go back to the 1930s, when it was first introduced by Italian psychiatrists Ugo Serletti and Lucio Bini. They observed that patients with epilepsy often experienced improved mood and cognitive function after seizures, leading them to explore whether artificially induced seizures could help severe mental illness. The problem? Early ECT was performed without anesthesia. Patients endured full-body convulsions, broken bones, and extreme distress. The sight of a person seizing in a hospital bed became so disturbing that ECT was branded as inhumane and cruel. Popular culture, particularly movies like One Flew Over the Cuckoo's Nest, cemented this image in the public mind. But modern ECT is nothing like that anymore. Today, patients receive general anesthesia and muscle relaxants, meaning there are no violent convulsions, no pain, and no distress. The seizures are controlled and carefully monitored by a team of medical professionals. Despite these advancements, the stigma remains, and many people who could benefit from ECT never even consider it as an option. This stigma is not just a social issue, it has real consequences. Studies show that many psychiatrists hesitate to recommend ECT, even when they know it could save their patient's life. This is tragic because ECT has one of the highest success rates in all of psychiatry. ECT is not for everyone, and it's not used as a first-line treatment. But for some people, it is the only treatment that works. It is primarily recommended when severe treatment-resistant depression does not improve with medications or therapy. Studies show that after failing at least 2 classes of antidepressants, patients are much more likely to respond to ECT. Suicidal depression requires immediate intervention because waiting weeks for antidepressants to work is too dangerous. Psychotic depression includes delusions, hallucinations, or paranoia. Medications alone often fail in these cases. Bipolar disorder leads to extreme depressive or manic episodes that cannot be stabilized with standard treatments. Catatonia, a rare but life-threatening condition where a person becomes unresponsive and physically frozen, has an 80% response rate with ECT. What makes ECT truly remarkable is its success rate. Studies show that 70–90% of patients with severe depression who do not respond to other treatments improve significantly with ECT. This is an astonishing number compared to the 30–50% response rates seen with antidepressants. I have personally seen cases where ECT completely transformed patients who had been in a deep, unresponsive depression for months or years. These were people who had lost all hope, who had tried every medication and therapy available. After just a few sessions of ECT, they started to smile again, talk again, and re-engage with life. ECT works by delivering a small, carefully controlled electrical current to the brain, triggering a brief, controlled seizure that lasts about 30–60 seconds. This might sound intense, but what happens next is fascinating. Scientists are still studying exactly why ECT is so effective, but here's what we know. Increases neuroplasticity, ECT boosts levels of brain-derived neurotrophic factor, BDNF, a protein that promotes the growth of new neurons and connections. This is crucial because depression is associated with reduced brain volume in areas like the hippocampus. Balances neurotransmitters. ECT rapidly increases serotonin, dopamine, and norepinephrine, the same neurotransmitters targeted by antidepressants, but much faster. Resets brain circuits. Studies using functional MRI scans show that ECT reduces overactivity in the parts of the brain responsible for negative thinking, while strengthening connections in regions that regulate mood and emotion. Influences peptides and hormones. Research suggests that mood-regulating peptides are altered in a way that makes emotions more stable after ECT. Unlike antidepressants, which can take 4 to 6 weeks to show improvement, ECT often works within days. This is why it is the go-to treatment for suicidal patients who cannot afford to wait. ECT is a short, controlled procedure that usually takes 5 to 10 minutes, with the entire appointment lasting about an hour. Here's what happens step by step. Step 1. Preparation. The patient receives general anesthesia so they are completely unconscious. A muscle relaxant is also given to prevent movement during the procedure. Step 2. Electrode placement. Electrodes are placed on the scalp, either bilaterally, both sides of the brain, or unilaterally, one side, usually the right, to reduce memory effects. Step 3. Electrical stimulation. A precisely measured electrical current is applied, triggering a brief seizure in the brain. Step 4. Recovery. The patient wakes up within 5–10 minutes, often feeling groggy but with no pain. Some temporary confusion may occur, but typically fades within hours. A full ECT treatment course typically consists of 6 to 12 sessions, done 2 to 3 times per week. Some patients require maintenance ECT, meaning they receive a session every few weeks or months to prevent relapse. ECT is one of the most effective and underutilized treatments for severe depression. It is not dangerous, not painful, and not the crude procedure Hollywood would have you believe. While I cannot offer ECT in my department due to organizational reasons, I strongly support its use in appropriate cases. As an alternative, I provide esketamine therapy, which has also shown great promise, but I'll cover that in another video. If you want to learn about other breakthrough depression treatments, including esketamine, psilocybin, and transcranial magnetic stimulation, TMS, check out my next video. Don't forget to subscribe, because understanding depression is the first step toward recovery.